Hi there, this is Dr. Evan Osar, developer of the Integrative Movement System. Welcome to this edition of Integrative Movement Insider, where we're discussing knee degenerative joint disease or knee osteoarthritis. So many of our older clients present to us with chronic knee issues that inhibit them from doing the things they need to, want to, and or love to do. And many of us in the health and fitness industry have knee issues based around some of the habits that we've created for ourselves. So we're in this edition of Integrative Movement Insider, we're going to discuss the most common reason many of us have knee issues, as well as our clients have knee issues, as well as a three-step integrative movement system process that we take our own patients and clients through to help them achieve more optimal function around their knees. So first, why do so many of our clients have knee issues? Why do so many of us have knee issues? Well, it really comes down to one thing. Now, while all joint conditions may have an element of genetics or hereditary causes to them, it really comes down to our habits and our clients' habits. It's how they stand, it's how they walk, it's how they load, it's the exercises they've done or not done. It's really that wear and tear over a prolonged period of time. And for many of us, it happens faster because we've done more non-optimal strategies around our posture and movement and exercise that lead to degenerative changes of the knee. Now, in this video, we're going to focus specifically on the knee itself. However, when clients come in and we're assessing them in our clinic, we're always looking at two important regions that impact the knee. Number one is the thoracolpelvic cylinder, or the core, the first rib all the way down to the bottom of the pelvis, because that will help us align that lower extremity, the hip, knee, ankle, and foot complex, more effectively and take a lot of the stress off the knee. The other area of the body we really pay attention to is the ankle and foot, because that will also impact what happens above it at the knee. So even though we're talking specifically about the knee here, and we will do things for our clients specifically for their knees, it's really about looking at what happens up here and down at the foot before we ever go right to the knee and start addressing the knee. Now, what's the integrative movement system process? It's really a three-phase process that we take our clients through. Phase one is the discovery phase, and that's really the history and the assessment, because that drives the second phase of the program, the integrative movement system corrective exercise strategy. And here is where we do our release work and our activation strategy that we ultimately take into phase three, which is the integration phase. In the next portion of the video, I'm going to show you exactly how we use these three phases. I'll show you a very quick and easy assessment. I'm going to show you a very easy release and activation, and I'll show you a very quick way to integrate this information from the corrective exercise strategy into our functional movement patterns.
A simple and easy assessment for the knee is the seated knee alignment test. While you're looking for it in the seated position, you really want to look for it as the client is standing a single leg, and loading as in a squat or lunge pattern. The femur and tibia should be aligned, as you see in my client's right leg. On the left leg, you'll see the tibia externally rotated. This is a common cause of knee problems, especially as the client loads, because it creates a lot of stress on the knee. Be sure to look for it in both a static as well as loading type positions. The integrative movement system corrective exercise strategy is essentially a three-step process. Release around areas of myofascial restriction, activate the stabilizers around the region where you're releasing, and then finally integrate that into the fundamental movement patterns to improve performance. When we're dealing with clients that have knee osteoarthritis, we're going to want to release around the posterior hip complex. So muscles like posterior fibers of glute medius, piriformis, and the deep hip rotators. We're going to activate the muscles to create better stability around the hip complex itself, and then we want to integrate these concepts into fundamental movement patterns. And with clients that have knee osteoarthritis, we want to focus upon the hip dominant patterns. So patterns like hip hinging, stiff-legged deadlifts, and reaches. So in the following example, I'll do a release for the posterior hip complex, I'll activate the stabilizers and use that movement through a hinge pattern, and we'll integrate that into a deadlift pattern from there. Begin releasing the posterior hip complex by sitting on the foam roller and crossing the leg over. Hold any areas of myofascial restrictions about 15 to 20 seconds before moving on to the next region. This will help facilitate more range of motion and release during the hip hinge pattern. Begin the hip hinge pattern by aligning the head and neck over top of the thoracolpelvic cylinder. Place the hands upon the pelvis with the feet about hip width apart. Maintain this alignment as you hinge forward or rotate the pelvis over top of the femoral heads. There should be no change in spinal alignment or thoracolpelvic cylinder alignment throughout the pattern. Focus on releasing through the posterior hip complex and lengthening the hamstrings during the eccentric or lengthening phase, and refrain from over-gripping as you stand back up to the upright position. Note the range of motion because this is the same range of motion that you'll use in the next pattern, the stiff-legged deadlift. During the stiff-legged deadlift, align the head and neck over top of the thoracolpelvic cylinder with the feet slightly wider than hip width apart. Use the same range of motion as during the hip hinge pattern. Maintain this alignment as you rotate the thoracolpelvic cylinder and pelvis over top the femoral heads. Lengthen the hips and posterior glute complex. Refrain from gripping at the end of the pattern.
In this video, we've talked about knee osteoarthritis or knee degenerative joint disease. We also went through the three-step process of the integrative movement system. The discovery phase, where we take a history and assessment, and I showed you a very easy, simple assessment, single leg stance. We took you through the IMS corrective exercise strategy, a very common release we do, and a very common activation strategy we use with our clients. And finally, we moved them into the integration phase of how to use the concepts from the corrective exercise strategy in a functional movement pattern to reduce stress upon our clients' knees. And this is a very effective process that we use with our own patients and clients to help them improve function of their knees so that they can do the things they need to, want to, and love to do. If you're looking for more resources, check out our Integrative Corrective Exercise Instructor program, as well as our free videos on our website, iihfe.com. Thanks for watching. This is Dr. Evan Osar. We'll catch you next time at Integrative Movement Insider. Take care.